Our public health program at Georgia State is really focused on applied public health and urban health. So urban areas often have the greatest disparities, and we try to do real work in the communities to understand better and address these health disparities. Marshall has been a real leader in this regard. He has opened the door to our students and our faculty about community-based research and listening and learning and respecting communities in order to understand how best to address these health disparities and achieve greater health equity.
Martha and Marshall are special people. They are committed to social equity, committed to public health, bring a mixture of skills between them to it. In fact, you could have a School of Public Health that was largely based on the faculty of Martha Katz and Marshall Kreuter and would cover most important subjects in it, and the students would enjoy it tremendously.
I began my career as a school teacher almost 50 years ago, 45 years ago. And I have always been committed to trying to create experiences that will help students learn and see the value of the content that they're dealing with. When I went to Georgia State to join what was then the Institute of Public Health, which is now the School of Public Health, I began doing that, and my bias for experiences probably led me into my own interest, which is community-based participatory research. I'm very grateful to Michael Erickson and his colleagues for providing support for a project that we did at Georgia State called Accountable Communities Healthy Together. It was a research project funded by the National Association of Minority Health. And we went into urban Atlanta and used the same principles we've been talking about. Community engagement, listening to them to try to address the health problems that they had. And it's a really good example of understanding the importance of listening to people.
I think the process is great. Whenever you have an opportunity to engage community into defining what the issues are that confront the community, I think one of the things that we as practitioners got to learn how to do is to listen to community, though. A lot of times we come in and we understand the process and we're so pointed on the process that we don't really hear what community is saying to us. And one of the powerful things that I've learned in my organizing is that the most powerful thing that we can do is listen.
Some 30 years ago, I had the opportunity to meet Marsh, who was a professor in health education at the University of Utah. And what I recall about his experience there and my experience with him was the training and education opportunities that he afforded students. One of those, a very unique experience, which I would call immersion learning, where he would put students in real world situations so that they would understand and appreciate the circumstances of the underserved, the institutionalized, the marginalized. And so from the very beginning, one could see the DNA in Marsh that spoke to social justice issues. Martha as well has a distinguished career in this area, and specifically in terms of her work in health policy. We can look around the state and find a number of health policy organizations that did not exist. But when she came to the foundation, she helped the foundation incubate a number of nonprofits, health policy organizations that specifically addressed health disparities and health inequities.
You know, my four grandparents were all immigrants. They came to this country with very little, but somehow or other, my grandmothers and my mom every Friday managed to be able to put a little something in the charity box. So it was very clear to us when we were small children that there were haves and have-nots in this world and that we were supposed to do something about it. That of course spills over into what you do as a person in your career. I've had the pleasure of working with both Healthcare Georgia Foundation and GSU. I got to be an early staff member at the foundation. I got to chair the board of advisors for the then very new School of Public Health. Then it was a public health program. Now it's grown into being a school. And as a member of the Georgia Health Foundation board, I got a chance to work with both of them as a colleague from that perspective. So that gives me sort of a nice picture of both organizations. They're very different because one's a private foundation and the other one's a university, and they have different missions, but they have a lot in common because both organizations have a real commitment to health equity. They know we've not achieved our goals in public health unless they benefit everybody, and especially the most vulnerable among us.
Martha was our first chairman of the board of advisors for the School of Public Health. And even today, this award that we're highlighting the careers of Marshall and Martha is the idea of Gary Nelson and the Healthcare Georgia Foundation. And without their vision and support and commitment, we wouldn't be here today honoring these great individuals.
It makes me feel proud that the colleagues that I've worked with over the years have made an effort to help other folks, and that that's why we're here, to help one another. And if this in any way benefits students, causes people to think about the importance of health equity, making health for all really something important, keeps it at the top of their mind, that makes me feel real good.
I'm sure having a named lecture series for them both delights them, and they're honored by it. And I suspect they're both a little embarrassed by it all too, because they're so humble. Well, tough luck, Martha and Marshall. You deserve this, and you ought to enjoy every second of it.